Optimum Health requires not only that you take personal responsibility for your healthcare and choose to be your own healthcare quarterback, but also that you wisely choose your healthcare team. Who should you choose to make up your winning team? I'll tell you who to consider and who not to pick on today's episode of Ask Dr. Walt.
Today, our health includes our mind, our body, and our spirit. Separating medical facts from fiction is the key that leads to wise decisions about our health and well-being. Unpacking the latest research is vital. Doing what works helps us live our best lives today. How can we live longer? How can we live healthier? Let's ask Dr. Walt on Liftable TV.
Hi everyone, I'm family physician Dr. Walt Larimore, and I'm really happy that you're taking the time to join me in my home office here as we're completing our 10-show discussion about the 10 essentials of becoming and staying highly healthy physically, emotionally, mentally, relationally, and spiritually. Now, in previous programs, we've already covered the first 9 essentials of true health, self-care, reducing sadness, stress, anxiety, depression, forgiveness, relationships, spiritual health, positive self-image, discovering your destiny, and becoming your own healthcare quarterback. And today we'll cover the last essential, teamwork in healthcare. And I really hope and I pray that these programs will convince you of the value of healthcare that considers and embraces physical, emotional, relational, and spiritual aspects of who you were created to be. Experiencing the best health requires not only that you take personal responsibility for your healthcare and choose to be your own healthcare quarterback, as we discussed last time, but also that you wisely choose your healthcare team. Now, in my last program, I discussed that the core of your team is you as your own healthcare quarterback. A great healthcare coach, such as your family physician or another primary care professional, and then the specialists or assistant coaches that can help you. So let's take some of your questions and comments about choosing other members of a winning healthcare team. And thanks to all of you who sent in your questions. I can't answer them all, but we're going to get to the most important ones. And I appreciate Kylie and Jordan helping me sort through them and put them in order for you. Now, oh, by the way, at the end of this show, I'll tell you how to send in your questions for our next program on brain health. So our first question comes from Olivia in Memphis, Tennessee. Dr. Walt, you've talked about the importance of everyone having a family physician, but how can I know if that physician shares my spiritual beliefs or not? That's a great question. Finding a physician or any other healthcare team member who shares your spiritual foundation and practices may be crucial for you. And it's actually fairly simple. You just ask your pastor or others in your faith community, such as dentists, nurses, pharmacists, psychologists, or even physicians in your faith community, if they've found physicians that might also meet your needs. Also, you can find a listing of the members of the Christian Medical and Dental Associations at cmda.org. Just click on the Member Search tab. Now, once you've picked a candidate, or maybe a few candidates, you can actually schedule an introductory visit. In fact, many physicians will schedule a short meet and greet visit at no charge, or you can certainly ask for that. Now, at your first visit with a prospective physician, whether a primary care or specialty physician, you can use a spiritual inventory to evaluate whether you and they are on the same page spiritually. Now, here's a few questions that you could ask at your interview of a prospective healthcare professional or during your first official appointment. Things like this, and you can adapt them to yourself. But number 1, are you willing to consider my spiritual preferences as you care for me? Number 2, are you open to discussing the religious or spiritual implications of my healthcare? Number 3, are you willing to meet or talk with my spiritual leaders, my pastor, priests, elders, if needed? Number 4, are you willing to pray with me or for me if I feel the need for prayer? Now, obviously, adapt these questions or come up with some of your own, but at least gives you an inkling of whether that person will honor your spirituality or not. And if not, you may want to find someone else. Max in Anchorage, Alaska. Dr. Walt, it seems to me that a pharmacist should be a vital part of everyone's healthcare team. Would you agree? Max, I wonder if you're a pharmacist. Well, whether you are or aren't, I couldn't agree more. I mean, one of the most critical members of everyone's healthcare team, especially if you take any sort of medication, whether a prescription medication, a non-prescription medication, or a natural medication like an herb, a vitamin, or a supplement, is a trusted pharmacist. Most pharmacies now have a consultation area where you can visit with your pharmacist. And like I say, if you're taking more than one medication of any sort, I always recommend reviewing these with your pharmacist. Now, mind you, prescription medications as well as non-prescription, review them with your pharmacist. And this is especially true if you're seeing multiple doctors or multiple specialists who may not be aware of the possible drug interactions that come with medications your other doctors give you because they don't know those medicines or they don't use them very long. It surprises most of my patients to learn that all natural medications, all herbs, all vitamins, all supplements can interact negatively with certain prescription medicines, certain over-the-counter medications. They can even interact negatively with some foods and some lab tests. Again, if you're taking more than one medication, prescription, over-the-counter, or natural, always, 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 always talk to your pharmacist and have them look up any and all possible interactions. And by the way, there are a number of great interaction checkers on the internet. Just Google drug interaction checker. And you can find them WebMD, drugs.com, Medscape, AARP's Health Tools, and a bunch of other reputable sites. In addition, if your family physician doesn't stock the vaccines that you or your children might need, many pharmacies now also provide vaccinations. Thanks, Max. Great question. Our next one from Gwen in New Brunswick, New Jersey. Dr. Walt, in an earlier program, you mentioned dental health as being part of our physical health. I've never considered my dental office part of my healthcare team, but I guess I should, right? Absolutely, Gwen. Your dental care team, especially your dentist and dental hygienist, can have a positive influence on your physical, emotional, and relational health. The connection between oral health and overall health is clear in multiple studies. As one insurance company writes, and I quote, "From heart disease to diabetes and oral cancer to premature births, dental care has an impact on total health and well-being." Our next question comes from Carly, Sugar Land, Texas. I think that's in the Houston area, isn't it, Carly? Anyway, I like how you include emotional, mental, and relationship health in total health. Does everyone need a mental health professional on their healthcare team? Well, Carly, I think that a well-trained Christian family physician or primary care specialist can provide not only basic physical care, but also mental, emotional, and relational health care. But when needed, your family doc can direct you to a psychologist, professional counselor, a social worker, or a marriage and family therapist. Each of these professions are licensed, certified, and trained to provide diagnosis and therapy for a variety of mental, emotional, and relational problems. Now, you can also call the counseling department at Focus on the Family. That number is 1-800-A-FAMILY. And you can find competent faith-based counselors in your area by just asking Focus on the Family. Finally, when needed, psychiatrists can be helpful. Those are physicians, either medical doctors, MD, or doctors of osteopathy, DO, who are specially trained in evaluating and treating mental health and mental disease. Now, unlike the other mental health professionals I've mentioned, these professionals, psychiatrists, can prescribe medications, order laboratory and other diagnostic tests, and they can admit patients to the hospital when necessary. But even psychiatrists themselves usually work with a multiple disciplinary team of mental health professionals. Our next question from Joanne in Lakewood, Washington. Dr. Walt, you always talk about nutrition and how important it is for overall health. Who can I talk to about improving my nutrition? It's a great question. I mean, Joanne, I always emphasize how your daily nutrition choices affect your physical, relational, and emotional health. And if you think you or your family's dietary habits need evaluation or repair, your family physician is always a great place to start. But seeking a dietitian or nutritionist is another option in finding healthy strategies for improving your nutritional health. But be very, very careful who you choose. Now, let's begin with those people who call themselves nutritionists. This group includes individuals with a broad range of credentials in training and nutrition. In over a dozen states, certain qualifications must be met before an individual can call themselves a nutritionist. Additionally, accredited certification grant titles like Certified Nutritional or Certified Nutrition Specialist, CNS. However, in those states that don't regulate the use of this term, anyone with an interest in diet or nutrition can call themselves a nutritionist. And these individuals may apply their interest in nutrition to anything from running a food blog to working with clients. However, because uncredentialed nutritionists typically lack the expertise and training for medical nutrition therapy and for nutrition counseling, following their advice could be potentially harmful. I typically recommend that my patients see a dietitian who is board certified and is a food and nutrition expert. And these professionals are highly educated in the field of nutrition and dietetics, the science of food and nutrition. And through extensive training, dietitians acquire the expertise to provide evidence-based medical nutrition therapy and nutritional counseling tailored to meet your or your family's need. They're called registered dietitians, or a more recent designation, registered dietitian nutritionist, or RDNs. And in my opinion, they're the most invaluable source regarding nutrition and dietary management of a wide variety of conditions. And in many communities, they have private practices. Others will serve on the staff of local hospitals, but even they are available for private consultations. So I hope that helps. Jean from Olathe, Kansas. Dr. Walt, what do you think about chiropractors? Well, I've got two thoughts. Many people include a chiropractor on their healthcare team. In fact, when I was serving as a volunteer physician for the U.S. Olympic Committee, each of our sports medicine teams included a primary care sports medicine specialist. That's what my role was. We had attached to me an orthopedic specialist, a physical therapist, an athletic trainer, a registered dietitian nutritionist, an RDN, and a chiropractor. Each of these specialists were critical to the health of our Olympic athletes. Now, chiropractors primarily utilize musculoskeletal therapies, but in my opinion, chiropractic care has evolved into two schools of thought. On one side are what I like to call the isolationists. These are folks who believe that their therapy can prevent and treat most diseases without the assistance of any other healthcare professional. And these folks will often try to convince you to sign up for long-term care arrangements. Opposite the isolationists are what are called the science-based rationalists. These are chiropractors who desire to be part of a traditional healthcare team. A chiropractor whose writings I follow, Samuel Homola, writes, and I quote, "Science-based chiropractors make appropriate judgments about the nature of their patients' problems, determine whether these problems lie within their scope, and make appropriate referrals for problems that do not," end quote. If you can find a chiropractor who uses manipulation and physical therapy appropriately and who is willing to coordinate with your personal physician, you can definitely benefit from the best that both professions have to offer. Oh, and I should mention that many osteopathic doctors, they have DO, Doctors of Osteopathic Medicine, after their name. They can also provide what's called osteopathic manipulative treatment, or OMT. And it's a set of hands-on techniques used by DOs to diagnose and treat musculoskeletal injuries. In fact, in my current occupational medicine practice at UC Health here in Colorado, I have a team of physical, occupational, and chiropractic specialists that I work with every day. And I consider all of them part of our healthcare team. Our next question comes from Tess in Stamford, Connecticut. How do you feel about alternative healthcare providers like homeopaths, naturopaths, herbalists, and those sorts of people? One thing's for sure, Tess, more and more Americans are inviting alternative therapists to join their healthcare team. Unfortunately, many of these alternative practitioners are unlicensed and unregulated, while others are just patently unscientific. Here's my biggest concern. Some of them dabble in spirituality that's antithetical, opposite to biblical teaching, and some even are immersed in what I would consider evil spirituality. Now, to read more in depth about these folks, let me recommend my best-selling book, Alternative Medicine, The Christian Handbook. Dr. Donald Omatuna, he's a PhD, and I wrote about the most popular alternative therapies, everything from acupuncture to yogurt. We describe several alternatives to traditional care that have evidence to support their use, like acupuncture and acupressure. However, we also describe many alternative therapies that have little or no evidence to back up their claims, and we found some to even be dangerous. Here's my recommendation. If you choose to add an alternative therapy to your healthcare, or if you seek the services of an alternative practitioner, do so under the supervision, under the advice of your healthcare coach, your family physician. Next question from Eleanor from Johns Creek, Georgia. The way you emphasize all aspects of health, especially spiritual health, shouldn't pair partners be a part of my healthcare team? Absolutely. As we've talked about before, good relationships are good for your physical and emotional health. But healthy fellowship and a loving, affirming, positive Christian community is exceptionally good for your health. I mean, one of the keys of health is having people who will pray with you and for you. And increasingly, scientific studies show that prayer affects many healthy outcomes, including anxiety disorders, cardiovascular disease, depression, disabilities, marital satisfaction, pain relief, recovery from a heart attack, recovery from surgery, recovery from an intensive care unit stay, helps substance abuse and generalized well-being, and I could go on and on. One research group demonstrated that the strongest factors for well-being, including life satisfaction and happiness, were frequency of prayer and prayer experience. And they also found that conversational and meditative prayers were more strongly related to well-being than ritual or rote prayer. If you're not a person of prayer, find someone who is. Ask this person if they'll begin to teach you to pray and if they'll pray for you. And if you don't regularly read and study the Bible, begin now. Find a friend or a pastor who studies the Bible and ask them to teach you how. Begin reading small parts of the Bible every day. Gradually increase your reading time. Ask a Christian bookstore sales associate to help you find a Bible that can provide guidance and interpretation as you read. Because both talking with God through prayer and listening to God with prayer and Bible reading together increase your likelihood of becoming and remaining a healthy person. Our next question from Sterling in Casper, Wyoming. Sterling writes, do you believe in support groups or do you think they're a waste of time? Well, for any of you who are dealing with a chronic health issue, whether physical, emotional, mental, or relational, even spiritual, then you will almost always benefit by finding a support group, an established group of folks who wrestle with the same health issues that you're struggling with. And you can often locate such groups by asking your pastor or family physician. Also, national associations have information on your particular disease or dis-ease. They may have information on local groups. And many churches have what are called Celebrate Recovery groups, which are terrific. Support groups provide a great forum for the dissemination of useful information and, more importantly, sharing personal experience and support. They can also be helpful to prevent or treat isolation or being alienated or suffering from loneliness that we talked about in a previous program. But you need to understand this, and I need to add this warning, that the internet has transformed the meaning of support group. Through social media, you can find hundreds of groups dealing with the same health issues and decisions as you. But an internet support group can never, never, never provide the same level of personal support and healing as when you meet people face to face. And also, studies have shown that the majority of medical advice given in internet chat rooms, on internet bulletin boards, or via internet support group websites is inaccurate, and sometimes it's even dangerous. Also, it's not unusual on these internet sites for people to try to sell you on scams or schemes or fraudulent supplements or supplies, while others are just plain and simple multi-level marketing organizations. Be careful, be careful, be careful about internet support groups. Wow. Derek, our time's about running out. I think I have time for one more question. Be okay? Okay. Derek says okay. This is from Delaney from Tulsa, Oklahoma. I've heard you recommend we have a family member or close friend with us when we visit the doctor. Can they be part of our team? And if so, how can they help? In fact, Delaney, I recommended this in the last program that I did, because not only can a family member or friend be part of your healthcare team, they can often play a critical role. Medical studies show that family and friends are consistently rated as the most vital support for people with health issues. And studies have also found that patients often believe the presence of a family member leads to an atmosphere of greater empathy and compassion from the professional healthcare team. In fact, the American Academy of Family Physicians points out that, and I quote, "The involvement of family members in the care of the patient improves communication among the physician, patient, and family, and helps with making an accurate diagnosis and planning treatment," end quote. Nevertheless, as on any team, there can be harmful team members. So one of my most important roles as a family physician is helping to empower my patients to fire family members or friends who negatively affect their health and well-being. In his book, Don't Let the Jerks Get the Best of You, Christian psychiatrist Paul Meyer talks in detail about removing the influence of negative family or negative friends. Another good book that talks about that is Jan Silvius in her book, Foolproofing Your Life. Well, my time's up for today. To continue your journey to becoming an extraordinarily healthy person, I hope you'll consider studying one of my best-selling books that goes deeper into all of these topics. Either Fit Over 50, Make Simple Choices for a Healthier, Happier You, or 10 Essentials of Happy, Healthy People, Becoming and Staying Highly Healthy. You can find them at drwalt.com. Just click on the tab that says books. And also at drwalt.com, you can sign up for both of my daily blogs. Medical News you can use as a once-a-day blog, and then twice daily, my biblical devotions called Morning Glory, Evening Grace. Well, we've now completed our programs on the 10 essentials of highly healthy people. So on to our next program, and I want to begin to address an issue that many of you have written me about, brain health. In fact, studies show that Americans are increasingly concerned. They're worried about dementia or Alzheimer's later in life. And so you may be wondering, what can you do, if anything, to dramatically reduce your risk of dementia or Alzheimer's? And I think you'll be shocked at what I'm going to tell you. And I'd love to hear from you. What questions do you have about brain health or about the supplement folks are trying to sell to you on brain health? Just send me your questions at drwalt@liftable.tv. drwalt@liftable.tv. Along with any other questions, general health questions that you might have. We're kind of grouping those together to plan future shows. That's drwalt@liftable.tv. So until our next visit, dear, dear friends, I pray that you may enjoy good health and that all may go well with you, even as your soul is getting along well. I'm Dr. Walt Larimore, and I look forward to seeing you for our next episode of Ask Dr. Walt.